This week, we reached 100 million reported cases. More cases have been reported in the past 2 weeks than during the first 6 months of the pandemic. A year ago, I said the world had a window of opportunity to prevent widespread transmission of this new virus. Some countries heeded that call, some did not. Now, vaccines are giving us another window of opportunity to bring the pandemic under control. We must not squander it. The pandemic has exposed and exploited the inequalities of our world. There is now real danger that the very tools that could help to end the pandemic, vaccines, may exacerbate those same inequalities. Vaccine nationalism might serve short-term political goals, but it's ultimately short-sighted and self-defeating. We will not end the pandemic anywhere until we end it everywhere. The world has come to a critical turning point in the pandemic, but it's also a turning point in history. Faced with a common crisis, can nations come together in a common approach? When a village is on fire, it makes no sense for a small group of people to hoard all the extinguishers to defend their own houses. The fire will be put out faster if everyone has an extinguisher and works together in unison. More vaccines are being developed, approved, and produced. There will be enough for everyone. But for now, vaccines are a limited resource. We must use them as effectively and as fairly as we can. If we do that, lives will be saved. That's why I have challenged government and industry leaders to work together to ensure that in the first 100 days of 2021, vaccination of health workers and older people is underway in all countries. My message to governments is to vaccinate your health workers and older people and share excess doses with COVAX so other countries can do the same. My message to people in countries that are now rolling out vaccines is use your voice to advocate for your government to share doses. If you're someone at low risk, please wait your turn. Health and care workers have been on the front lines of the pandemic, but are often underprotected and overexposed. They need vaccines now. They and their families have already paid an extremely high price in this pandemic. Protecting the people who protect us is the right and smart thing to do. In the early days of the pandemic, as you remember, people showed their love and appreciation for health workers by applauding on their balconies. Now it's time to show our love and appreciation for health workers by making sure all health workers are vaccinated. Today, I'm honored to be joined by 2 health workers who have been delivering health services throughout the pandemic. Harriet Naiga is a midwife from Uganda. Harriet, thank you so much for joining us today. Please tell us about your experience working through the pandemic. You have the floor, Harriet.
Thank you very much, Dr. Tedros. Thank you very much, Dr. Tedros, for this great opportunity. My name is Naiga Harriet from Uganda. I'm a midwife. I'm a director of MILCOT. MILCOT is Midwife-Led Community Transformation, which is a community-based organization which is aiming at bridging the gap which is existing between the midwife and the local community through provision of sexual reproductive health and rights to marginalized adolescents and young adults. So I'm very practical in the community through preventive initiatives. My work is going down to the grassroots to engage with the community adolescents and young adults. However, when the pandemic came in, things changed and I could not access these groups. We could only access them via phone calls. And then when the lockdown was open, we do not have enough SOPs in the marginalized communities. And that means I, as a midwife, together with my team that I lead, we are very, very vulnerable to the disease because the communities that we engage with do not have enough to provide, to prioritize having SOPs in place. So that means we need to be prioritized when the government gets the vaccines in the country, as well as my fellow nurses and midwives whom I engage with, who are in the health facilities, because we do also engage with them as we provide them with resilience, with the knowledge and skills towards the provision of youth-friendly healthy services, but they also tell that they would love to have the vaccines as early as possible because they engage with large numbers of patients, and us as nurses and midwives being on the front line, and we engage with the patients with, for more hours than any other health worker. So we need to be prioritized, and we really thank WHO for the move that you have taken on producing the vaccine. That will be very great for us, the nurses and midwives, if it comes. And I appeal to the government for because of the efforts that it is putting in to have the vaccine in place. We also ask the government that when it comes, nurses and midwives are prioritized to be vaccinated first. Thank you very much.
And I hear your call that you would love to be vaccinated so that you know you're safe to protect the mothers and children you work with. Thank you so much again. Asante sana, my sister. Now to our second guest, Sana Belloch is a nurse from Pakistan who started her career during the pandemic. Sana, thank you so much for joining us today. And we look forward to hearing about your experience working on the pandemic and your hopes for the year ahead. Sana, you have the floor.
Thank you so much, Dr. Tedros. Thank you for inviting me here. My name is Sana Belloch, and I'm a recent graduate of Science in Nursing from Aga Khan University, Pakistan. I actually started my career as a nurse during the pandemic, where when a student nurse transitions to a professional nurse is itself usually a challenging time where you need the best supervision and best mentorship to do your skills in a clinical side. Unfortunately, we were transit in a time where we were the only ones who had a great responsibility to deal with the patients. Where most of the staff were isolated, they were infected, and they were exposed. The burden and the shortage of staff was huge, and we had a huge influx of patients. We were trained within few weeks to take care of the patients in COVID ICU when there were new units built up in a couple of weeks. So we as nurses, the doctors and paramedics were in a great distress, but yes, we had no escape. It is our moral responsibility, and it was our job to take care of those patients. We were the only hope of the patients and their families who were isolated and admitted in COVID wards, and where they were not allowed to meet or to see anybody. We cannot deny this. We cannot leave them alone, but at the same time, we need protection. We need understanding of the policymakers, our managements, and the government to protect us, because by providing the complete PPE and, of course, vaccination, because the PPE is disposable, but the healthcare workers are not disposable. So we thought that the cycle was continuous during the year. The pandemic to 2020, we were exposed, we were isolated, then we just had to wait when we will recover so we can go back and take care of our patients again in a COVID ward. So there were our colleagues who were really sick, who were not able to breathe in, but after 20 days of their hospitalization, they were there standing in the wards and taking care of the patients. Around 10,000 of the healthcare staff has been infected in Pakistan, and more than hundreds were died. And they were not old, they were young, they were our colleagues. And because of less resources, less PPE, and of course now when we talk about the vaccination, it is the responsibility of the world leaders and most developed countries to help the humanity and the healthcare providers first to protect them so that they are able to deliver the best quality of care and they are safe in order to provide care. Because the healthcare providers are the ones who are not going to any gatherings. They are the ones who are following all the SOPs, but yet they are the most vulnerable. They have to take care of the patients. We had to give the bath, we have to take care to the clothing and everything of COVID patients and people who are on ventilators, unable to breathe. There is no escape, and we as healthcare workers, the doctors, the young doctors, nurses, midwives, and all paramedics look forward to the world that they will decide on the basis of the humanity, because it is not something as state level, it is something as a human being. And we as a world can only fight with the virus when we think of providing safe services to our healthcare providers despite of the borders. So yes, I appeal to the leaders of the world that please distribute the vaccine on equitable categories. If you have enough of the resources to vaccinate all your elderlies and all your healthcare providers, so do consider to donate or help out lesser developed countries who do not have enough to even vaccinate their healthcare providers or elders before moving towards the less vulnerable population of yours. Thank you, Dr. Tedros.
Thank you so much indeed. Thank you. That's very, very clear. So again, thank you, Sana and Harriet, for joining us today. You have my deep respect and admiration for the work you do every day to save lives and deliver health services to those who need them most. We're proud of you. And you have my commitment that we will do everything we can to ensure you and your colleagues are vaccinated as soon as possible. The theme for World Health Day this year is health equity. Equity is at the heart of everything WHO does. This week, we have released 2 products to close gaps in care and improve health outcomes globally. The first is Essential Diagnostics List, a basket of diagnostics that WHO recommends should be available at point of care and in labs to improve timely and life-saving diagnosis. The COVID-19 pandemic has reinforced the value of timely and accurate diagnostics to save lives. Without them, you're flying blind. The latest edition of the Essential Diagnostics List includes tests for the COVID-19 virus, expands the suite of tests for vaccine-preventable and infectious diseases and non-communicable diseases, such as cancer and diabetes, and introduces a section on endocrinology, which is important for reproductive and women's health. The second product is a new 10-year plan for neglected tropical diseases, a set of 20 illnesses that affect more than 1 billion people, most of them poor. The plan includes ambitious but achievable targets to reduce the number of people who need treatment for a neglected tropical disease by 90%, to achieve the elimination of at least 1 disease in 100 countries, and to eliminate 2 diseases, guinea worm and yaws, globally by 2030. Together, WHO and our partners are working together to ensure neglected tropical diseases are neglected no more. These are just 2 examples of the many ways WHO works every day to fulfill our mission to promote health, keep the world safe, and serve the vulnerable. I thank you. Fadila, back to you.
Thank you, Dr. Tedros. I will now open the floor to questions from members of the media. I remind you that you need to raise your hand using the raise your hand icon in order to get in the queue to ask your question. And don't forget, please, to unmute yourself. We welcome also questions from journalists to our wonderful guests, Harriet and Sana. So please don't hesitate to ask your question. They have the experience from the field, and it's interesting to hear from them also. I would like to start the question and answers with a journalist from Cancun, Mexico, Paulina Alcazar. Can you hear me, Paulina?
Hola, Fadela, gracias. Sí te escucho. ¿Me escuchan ustedes?
Yes, yes. Please go ahead.
Muchas gracias. Gracias. Los viajes internacionales no cesan, van en aumento, y hay un nuevo requerimiento de países que piden pruebas, PCR o antígenos para regresar a su lugar de origen. Esto está creando una nueva presión en los testings. ¿Tienen consideraciones promover la vacunación como segundo grupo en prioridad al sector turístico, tripulaciones, hotel, staff y aeropuertos? Gracias.
Thank you, Paulina. Dr. Ryan will take it.
I can start there. I think the question actually specifically relates to vaccinations of people working in the industry, but with specific reference to testing as a measure. Testing is being increasingly used in different parts of our society to do different things, and certainly the expansion of rapid diagnostic tests is bringing a new and very useful tool to bear, taking pressure off the existing PCR-based testing systems, and fully expanding the use of validated rapid diagnostic tests is a major aim of WHO, our partners in FIND and UNITAID, and within the ACT Accelerator. I think Bruce will confirm that. The specific issue around increased testing requirements. Countries right now are in different situations. Those countries with very low incidence are very, very afraid about re-importing cases and may have more stringent testing in place. Other countries are worried about the arrival of potential variants that will further complicate their situations, and they're targeting reducing movement from certain countries in order to be able to avoid that. It's a difficult prospect, and we do need is coherent messaging around travel requirements. The process of travel itself has been significantly de-risked, and to the travel industry and others, they deserve credit for having put in place a lot of measures to reduce the risk of transmission during the travel process. Managing the arrivals in terms of quarantine and supported quarantine, testing and other measures is difficult. And I know a lot of countries now, and it's something we've been saying for many months, when we're talking about dealing with either contacts of cases or people arriving from high incidence countries, if you are going to require that travellers arriving in the country quarantine for a particular period or have to be tested, then governments should be supporting that process. It is very difficult for a traveller arriving to be able to comply sometimes if they don't get the support to comply. So if governments are going to require that people stay in a hotel for a period of time, then those facilities that are provided should be adequate, and people should be able to do that with a minimum level of comfort and be able to live properly. So as you see, governments are continuing to try and increase and ramp up their efforts to break chains of transmission and to manage risks. But we also must do that and invest properly in those mechanisms, so not only citizens in countries, but people who are travelling between countries are treated with respect and with due regard to their comfort and their human rights.
Thank you, Fidel, and thank you, Mike. Thank you for the question. So on the issue of prioritizing the use of vaccines, it's an extremely important point, and thank you for raising it again. But we need to be clear, and again, the Director General spoke about the toll of this disease and the disproportionate effect of this disease on highly exposed populations in the course of their work, our healthcare workers, like we heard from Sana and Harriet today, and then also, of course, our our older populations. And when faced with a life-threatening disease and what is a ubiquitous risk and threat here of this, of this virus, we have to be extremely careful about how we use the scarce resources that we have to reduce that risk. One of the most precious things we have right now are the vaccines. You have seen in the media reports and elsewhere the struggles, the challenges companies are having just making even what they had planned to make and getting it out there on time, getting it distributed. In that situation, we have to prioritize the people, not who are inconvenienced by COVID-19, but the people who need this to help prevent them from possibly dying of the disease. And we know the people at greatest risk are healthcare workers. You just heard from two heroes of the healthcare profession right at the front line who cannot help but be exposed in the nature of the work they do. Then we have our older populations, and then we have populations with known comorbidities, as you've heard about. We need to make sure that the vaccine, this precious and rare, scarce, unfortunately, commodity right now, is used to reduce the risk of severe disease in these people. And then on the issue of testing, as Mike mentioned, you will have seen just over the last couple of weeks some exciting new partnerships that are evolving to try and make sure that we can make testing, accurate testing, available on even a bigger scale. And one of the things, two of the ACT-A partners announced just last week was that they have now struck a deal to try and make a highly accurate rapid diagnostic test available for low, middle-income countries for $2.50. And so that's the kind of partnerships we're getting down now to the price ranges where we can really get testing up, like you said, Mike, to the levels it needs to be if we're going to be able to rapidly isolate, detect and isolate people who are infected with the virus to prevent that spread.
Thank you both. I would like now to call on Christian Ulrich from DPA to ask the next question. Christian, are you online?
Thank you, Fadela.
Yeah.
My question is on the expert mission in China. Can you update us on what exactly is going to be on their schedule for the weekend? Is there a visit to the Virology Institute, for example, or to the market? Thank you.
Thanks. I'd be very good if I could tell you what my schedule was for the weekend. Never mind the one of our team, and I'm sorry not to. I think you'll understand that the team is in a dynamic situation. There is a very long list of site visits planned, and face-to-face meetings continue. The visits will include the Wuhan Institute of Virology, other labs, the Hunan markets, early responders, hospitals in which the first clusters of cases occurred. It was a very busy schedule, and I also wonder sometimes the media accompaniment of the teams is much larger than the international and Chinese team put together. It's obviously a very good thing that we have that transparency, but it's also important that we let the team get on with the business of the work they're doing. We're here to support them. We continue to support them logistically and diplomatically, and we'll continue to do so. But and again, the DG has said that we continue to be hopeful that that all of the data and all of the meetings that they need will be had, and just to reconfirm that all hypotheses are on the table, and we're looking forward hopefully to a successful conclusion of the mission. But in that I would just like to caution everyone, success in the case of animal-human interface investigations is not measured necessarily in absolutely finding a source on the first mission. This is a complicated business. What we need to do is gather all of the data, all of the information, summarise all of these discussions, and come to an assessment as to how much more we know about the origins of the disease and what further studies may be needed to further elucidate that. Maria, any comment?
Just very quickly to say that the team is on the ground, and we're all watching them as you are with the media attention. So I would advise to please be careful with the team and as you are taking those pictures, because we have seen some harrowing videos of people following them in cars. But as Mike has said, the scientists are at work Just one thing to mention, myself been on many missions for WHO. The mission team needs to decide what they do as they learn. And so they may show us a schedule, which we haven't seen, but they're working very hard to see all of the different places they want to go. They may change their mind and go to different places. We need to give them that freedom and that liberty to go and evaluate what they need to evaluate and visit where they need to visit. So we wish them very well. And as Mike said, we look forward to learning more.
Thank you. I would like now to invite Simon Ateba from Africa News Today to ask the next question. Simon?
Yeah, thank you for taking my question. This is Simon Ateba from Today News Africa in Washington, D.C. Last Thursday, WHO Africa warned that Africa was again in danger of being left behind, with only 25 people vaccinated in Guinea so far. And yesterday, WHO Africa said the new variant were pushing up death and new cases, with almost 6,200 people dead on the continent in the past week alone. Can you please give us an update on vaccination in Africa, on other new variants in the continent? When exactly do we expect serious vaccination to start happening in Africa beyond repeated promises from COVAX? And what does the WHO think about the Russian vaccine that was discussed yesterday with authorities in Algeria? Thank you.
Thank you, Simon. I would like maybe to invite Dr. Soumya Swaminathan to take part of this question. Soumya, are you online?
Yes. Thank you, Simon. And I will start, and Kate or Bruce might want to add. I think this is what is topmost of our minds, and in terms of getting vaccines to people, especially to those who are at the highest risk. We have two frontline workers who've spoken to us today. So clearly, healthcare workers and others who are at high risk of both getting the infection and dying from it need to be in the front of the queue to get the vaccines, regardless of where they live. And this takes us back to what the DG has called for already. In the first 100 days of this year, we should start seeing vaccines rolling out in all countries. Now, how do we do that? We're doing that through COVAX. And we last week announced that we had signed a deal with Pfizer, which is a vaccine that has received WHO emergency use listing as well as SAGE policy guidance. It has challenges of ultra cold chain, but those can be overcome. And so we're hoping very soon in the next couple of weeks to start dispatching the first consignments of this vaccine to countries around the world that are part of the COVAX facility so that they can start vaccinating their health workers and the most high risk. We also expect to start receiving doses of the AstraZeneca vaccine. Now, currently it is going through the regulatory review at WHO. You must have heard that the European Medicines Agency has just given it a conditional marketing authorization. We need to review the dossiers independent of that because the manufacturing sites for the vaccines that will come to the COVAX facility are different from the vaccines that will go to Europe. So we are hopeful that in the next 2 weeks at the most, this should happen, that we should have an emergency use listing, provided that everything, of course, goes according to plan and all the data is there, and that we can then start receiving doses of the AZ vaccine from the manufacturing sites in India and South Korea, and those should also be going out to the countries. Meanwhile, of course, we're working with the countries on getting absolutely ready with everything that's needed, and we've gone through that before on what are all the elements of preparedness at the country level, so that the day the vaccines arrive in the country, they can start being deployed. And there are many, many things that countries need to do to get ready. We've seen even in the high-income countries that it's not just a question of having the vaccine in the refrigerator. It takes a lot from that point to actually getting it into people at the pace at which we want to move. So February is definitely our goal. The earlier, the better. And we will try to expand as rapidly as possible through the COVAX facility. Thank you.
Thank you, Dr. Swaminathan. Now we would like to ask Dr. Simao to address the question about the Russian vaccine. Thank you.
Thank you, Fadila, and thank you for the question, Simon. WHO has under assessment at this stage 4 vaccine candidates. The 2 are the AstraZeneca derived, and just piggybacking on the issue of the EMA approval today, it's a very useful approval because it approves the core data, and the core data is useful for all the sites that are, you know that AstraZeneca has 8 different manufacturing sites. So WHO is at the final stages of assessing the sites that will provide to the COVAX facility, which are the SK Bio in Korea and the Serum Institute in India. We are also in advanced stage of assessment of Sinopharm and Sinovac, and at this stage we do have a team in China to do the inspections in the Chinese facilities. Regarding the Russian vaccine, we did have last Friday we had a new meeting with the manufacturers. And there's still, WHO is still waiting. There will be subsequent meetings. WHO is still waiting for some core information, some vital information to be presented, and this should be happening in the next few weeks. Thank you.
Dr. O'Brien, you have the floor.
Yes, just to add a couple of things to what Sumia and Mary Angela have contributed. On the country readiness, I think what I really want to communicate is the full readiness that many countries have to get started, and yet there are countries that still have a ways to go to be prepared. In addition to that, there are choices, as has been indicated, about the vaccines that are coming through the COVAX facility, and not all countries want to proceed with some of the ultra cold chain issues that are at hand, and are making decisions about what the sort of optimum mix of vaccines will be in their program. So the COVAX facility is ready, as Sumia said, is ready to deploy vaccines in the next coming weeks, and countries are in the process of communicating and being communicated with about what those allocations will be. I want to direct your attention to the COVAX facility website, which does have now supply projections over time by region and by product. And I think those are useful pieces of information for you to draw on about what the COVAX facility is projecting to deploy.
Thank you. I would like now to invite Jeremy Lunch from Radio France Internationale to ask the next question. Jeremy, can you hear me?
Yes, thank you, Fadela. Thank you so much. Apologies if the question has been asked earlier, but I was a bit late. I just wanted to have a comment from the WHO about the recent ban, vaccine exportation ban from the European Union. Thank you.
Dr. Simao.
I'll start, and thank you for the question, Jeremy. It's actually, it's a very worrying trend. We have seen last year, in the beginning of the year, when we had the first lockdowns affecting the big producer of essential medicines. We had export restrictions at the time of active ingredients for essential medicines. So this is very much a movement that concerns WHO, because we understand that no product nowadays, not WHO understand, that's the truth, actually is made in only one place. There are multiple elements. When you get a medicine or you get a vaccine, you're getting products that are coming from many places in the world. So it's not, let's say it's not helpful to have any country at this stage putting export bans or barriers that will not allow for the free movement of the necessary ingredients that will make vaccines, diagnostics, and other medicines available to all the world. So I don't know if anyone wants to complete.
I think, and this is the kind of thing Mike is really on top of. At the beginning of this crisis, you'll remember one of the things that made it particularly difficult for countries to manage the challenges cases escalated in their countries was the increasing, let's say, nationalization in some cases of some of the products that were needed to fight this pandemic. What we saw as we got out of the challenges around PPE, around ventilator shortages, et cetera, was really a tremendous commitment to work together and a recognition, as Mariangela said, that the world was going to have to collaborate to get out of this together. And so a huge amount of work was done through the ACT Accelerator, the COVAX mechanism, and numerous other approaches to try and ensure we didn't end up in that situation again, because the tools that we need to tackle this disease are scarce and they're not available everywhere. But the people who are at risk and who are threatened by this disease, of course, are distributed throughout the world. So it's absolutely essential that trade barriers or restrictions do not get in the way of trying to beat this disease on a global scale. And ultimately, as Mariangela outlined, it is such an interconnected world that we are working in today. Parts of a vaccine, some of the raw materials may come from one country. It may be made into the vaccine in another country. It may be filled and finished in yet another country or labeled. So this can end up being a self-defeating approach, actually, as well. And, of course, most people are well aware of that, and most people are very, very keen to ensure that these tools can get to the people who need them everywhere on an equitable manner, because ultimately that's what we're trying to do, ensure the equitable rollout of these products everywhere. So anything that gets in the way of equity is a challenge.
Thank you. I would like now to invite Lynn Eaton from the BMJ, British Medical Journal, to ask the next question. Lynn, can you hear me?
I can, and thanks for taking my question. Obviously, being based in London, we're very much aware of the concerns between the UK and the EU over supplies of AstraZeneca's product. Aside from that particular debate, I'd really like to set that in the context of what will it mean globally if we get different countries having different vaccines, failing to supply to the level recommended in the original license, and then we've got gaps in provision. What does that mean to the progress of the virus, particularly, and risk of it mutating further? Thank you.
Thank you, Lynn. Dr. Aylward will take this question.
Thank you, Lynn. I think that's an important point that you make, because what we talked about the last time was the challenge in terms of just getting the vaccine out to people everywhere. But as Mike has emphasized every time he speaks, is that unless we keep this disease under control everywhere, we are providing it more and more opportunity to mutate, to have new variants, which you're already seeing evidence of, have concerning trends in terms of their transmissibility or the disease they may cause. So anything, once again, that restricts ability to get these products out to as many people in as many countries as possible, the more we are going to have challenges, not just in terms of that equitable goal we talked about and that goal of reducing the risk of severe disease and death, but also our ability to control the disease and prevent the emergence of new variants. Mike, I don't know if you wanted to speak to that, or Maria.
Yeah, thank you, Bruce. Just because you brought up the variants, I think it's worth mentioning there's a lot of attention to these virus variants that are being detected in a number of countries. And on the one hand, we expect the virus to change, given we've had more than 100 million cases globally, and that's an underestimate. We're tracking these changes over time, and we need to evaluate each one of them to better understand any changes in transmission, severity, and impacts on diagnostics, therapeutics, and vaccines. Yesterday, we held a seminar with more than 2,000 of our partners, partners in our international networks, partners in our R&D Blueprint for Epidemics working groups related to COVID research, GOARN partners, and interested individuals. We've sent this through our networks to discuss variants and transmission. And this is really important because we have these tools, we have these interventions that are in place, individual level measures, population level measures, and we have diagnostics, we have therapeutics, and we have these vaccines that are coming online. All of these work and what we are learning from the research that is being undertaken in countries like South Africa, in the United Kingdom, in Denmark, in Brazil, is that there may be some increased transmissibility, but the interventions still work. The interventions that are in place can break chains of transmission, can protect individuals from infection. We need to stay focused and use all of the resources that we have. We need to make sure that we prevent as many infections as we can for the obvious reasons of preventing infections and severe disease and death, and putting our health workers at risk who are risking their lives every day to care for our loved ones. But also, as vaccines roll out, we need to keep the pressure on the virus as low as we can to minimize the pressure on the virus to change. So there are many, many reasons we need to stay the course, stay focused on what we can do to save as many lives as we can as vaccines are rolled out. But this meeting we held yesterday was really important to put on the table everything we know about the studies that are underway. And there are many. There are epi studies and phylogenetic studies and hospital-based studies and environmental sampling studies. And we are working with partners and grateful for partners sharing us these results in real time so that we can advise on any changes. Our IPC guidelines development group also met today to discuss any of these changes that may be necessary. And based on the information that we have, at the present time, and as I say, we are still continuing to learn, we're not making changes to our recommendation, but we are constantly looking at the evidence to see if anything is different, and we will make changes as necessary. But we have to stay the course, use all of the interventions that are in place to keep people safe.
Sorry, just to come back in for a sec, but the last point that Maria made is so important, because we often answer the question we're asked, okay, well, what about vaccines and this? But this is not just about vaccines. Lynn, to your point, any time we back off on any of the measures, we're giving the virus more space and we're taking the pressure off the virus, as Maria said. So it's not just a question about vaccines. Every time we're asking these questions of vaccines, we should be asking about the other things that we're doing, the rapid detection, the isolation, the quarantine, the masking, because these are the measures that we're going to rely on this year. And too often the conversation is just about the vaccines. It's just one part of the armamentarium. We need the whole thing to work. And if anything, the emergence of variants of concern on 3 different continents and 3 different settings should just be a clarion call to the world that you need to keep the pressure on the viruses. You're not going to have enough vaccine to do that the way we'd like to this year, and we don't even know that the vaccine would be able to do that completely. So we've got to be applying the other measures as Maria's spoken to and Mike always does.
Just very briefly, and just on this issue around vaccines and vaccine contracts, I think we heard nursing colleagues on it. I think we all need to step in to the place of them and where they are today fighting in the front line, standing in ICUs. They're right down the end of the queue right now, and they're looking up to the top of the queue. And the people at the top of the queue are fighting about where they are in the queue. I mean, that's what it looks like. Fighting over the cake when they don't even have access to the crumbs. So I think we need to step back and reflect upon our brave colleagues and where they stand today and what we're going to do about that. And we need to reflect on that. We are all desperate. Everyone is desperate. Governments are desperate to service the needs of their citizens. That's their mandate. But we all need to say, would I put a vaccine in my arm today if I thought that a health worker in the South would not get a vaccine today? And I think we all need to examine our own consciences and then tell our political leaders and others what we want them to do.
Thank you. I would like now to call on Christoph Vogt from AFP to ask the next question. Christoph? Christoph?
Can you hear me now?
Yeah.
Thank you for taking my question. I was just wondering about what we talked and saying that we need to share the vaccines that we have, and is there I was just wondering if there is a way that WHO could be a go-between. We have seen a few tries at enhancing more capacity production with Sanofi and just this today, Novartis. Is there anything where the WHO could help to find more production capacity in the world and to kind of make all those people work together? And just a very quick second question is, are you worried about how safe the deals are with COVAX?
Thank you, Christophe, for your two questions. We try to allow only one. Dr. Simao, you have the floor.
I'll start with the production capacity, because this is quite an important question, and because we are looking at two things. First of all, we are looking at the vaccines that have proved to be safe and effective, and that are also quality assured, right? That's one side. The other side, it's how fast they can be manufactured around the world. And WHO has put together, at the request of Costa Rica, a proposal for a COVID technology access pool, where we have on one side a call for increased sharing of knowledge and technologies, including technology transfer, and on the other side, also a call for increased voluntary licensing through the medicines patent pool. The World Health Assembly is also discussing it, will be discussing in May, a resolution on increased local production capacity across in different countries. And this is very important right now, because what we see is that we need, what is this global crisis has shown us, is that we need to diversify the supply chain. We need to make sure that we have increased capacity in different parts of the world. Right now, it's very concentrated in some countries and with some companies. So this is a venture that goes beyond COVID. But the CETAP provides a platform where voluntary mechanisms can be put in place to help countries and to increase the possibilities of technology transfer between different manufacturers across the world. I think this is going to be important. It is important for vaccines, but it's going to be important also for any therapeutics that proves to be safe and effective against COVID. Thank you.
The second question, Dr. Aylward.
Sure, thank you very much. The question was, how safe are the deals with COVAX in terms of the products? I think, as most of you know, and we announced, if I remember correctly, last Friday in the DG's presser, the COVAX facility has now got secured and guaranteed volumes of, deals, pardon me, for over 2 billion doses of vaccine for this year, and then we have options on doses, over 1 billion doses additional. So how safe are those deals? Well, the deals are safe. The question is, how safe are the volumes? As you've seen, a number of companies recently announce making vaccines is hard, and there's unpredictability in some aspects. This is a biological process. You know, the projections that companies made about how many doses, they were pushed very, very hard. They tried to maximize their doses, but that depends on many, many factors, whether they'll be successful in doing that. And some companies in some places have had problems with what we call the yields from their products, which ultimately tells you how many doses you can get of the vaccine, and they've been lower than expected, meaning that they've had to announce lower amounts. So the deals are safe. The question always is the volumes. Will we get to the volumes that are very, very ambitious? And that will be the challenge as we go forward. And this is why, to the point that Mariangela was talking about, you know, COVAX and the ACT Accelerator, much of it has been a fantastic success. The ability to repurpose the international health architecture and move so quickly on an end-to-end global solution for something like as challenging as this, taking a unknown disease and having a vaccine to reach billions of people in a year is simply extraordinary. But as you look at that end-to-end solution, we had a great research capacity around the world that really kicked in. We've got great procurement capacities through Gavi, and then working with UNICEF, PAHO, and others, and great distribution networks. But right in the middle of that, there's a critical piece of the pie, and that's the ability to scale up those products very, very quickly to scale. And we're paying a bit of a price for the fact that there's been a contraction in global producers of vaccines for years. It's a difficult business to be in. And as we go forward, part of what we're going to have to look at is take a hard look at how do we solve that and make sure that we can move more quickly. Because in the middle of a crisis, trying to just, like Mariangela was saying, move the technology to another company or someone who's never made a vaccine is very, very difficult. These are hard products to make. So this is going to require a longer-term solution as we go forward.
Thank you. Let's go now to Colombia. Andres Gil from NTN24. Andres, are you with us?
Hola, ¿me escuchan bien? Buena tarde.
Buena tarde. Go ahead, please.
Gracias, gracias. Mi pregunta es, ¿ya hay aprobados envíos de vacunas por mecanismo COVAX para países de América Latina? ¿Era posible que hoy, 29 de enero, hubiese un anuncio sobre ello? En caso afirmativo, ¿cuáles serían esos países que recibirían los primeros envíos de vacunas COVAX? Y si hay cantidades o fechas para esos envíos. Gracias.
Sorry, I was getting tired of hearing my own voice and hoped someone else would take a question. So, indeed, you're correct. What's happening today, the COVAX facility is working on what they call indicative allocation. So they're looking at the products that they have in the pipeline for the next quarter or 2 quarters, and these are primarily AstraZeneca products, products from the Serum Institute of India, et cetera. They're looking at the volumes that have been confirmed by the company, and then they're working with WHO and the allocation mechanisms that Mariangela runs to do what we call an indicative allocation, to try and give countries a picture of how much of that vaccine they can expect and when they can expect it, based on 2 critical factors, though. When the regulatory processes will be complete. We have promised the world, we've promised the people of the world that we will only supply products that we can absolutely assure the efficacy, the safety, and the quality. And that takes time. It takes a lot of data, a lot of review to go through that, and that's what's happening right now. So if that part goes properly, which we're anticipating by early to mid-February for these products, and then the second thing is the volumes. Are the companies going to have the volumes? And as you know, some companies are having challenges, so that is going to affect potentially what those volumes actually look like. So the goal this afternoon is to provide, or this evening, pardon me, or in the next day, what would be called indicative volumes, or indicative, and that will help the companies, or sorry, countries to really begin planning then. All of a sudden it's very, very real, that you know the baby's coming, and it's time to start planning and getting everything in place, those parts of the readiness that aren't ready. So that's to help countries plan and get their readiness in place, and with the hope that then these products will start to move in February. In addition, they're also looking at a potential first wave activity that involves the Pfizer product that was announced last week. So these are the pieces that are hoping to communicate as soon as possible to countries.
Thank you. I would like now to invite Jamie Keaton to ask the next question. Jamie, Associated Press.
Thank you for that. And nice to see you all again. There was an important decision that came from the European Union today about restrictions of the possibility of the export of vaccines from the bloc. We've talked, Dr. Tedros talked about vaccine nationalism. We're hearing about getting to the front of the queue. We're talking about worrying trends. I would really like you to please try to address that specifically, about how concerned you are. Is that a sign of the vaccine nationalism that you're talking about? And how concerned are you about that decision? And in particular, what is the specific impact that it could have on countries that are waiting for the AstraZeneca vaccine? Thank you so much.
Thank you, JB. Dr. Simao.
Hi, Jamie. I think we had already answered a similar question before. So Of course, there is always a lot of concern when any country decides or any bloc decides on restrictions or export bans on what we call global public goods. And what was mentioned before today already was that it's particularly concerning because the global supply chain is so diverse now, and it's so, how to say, fragmented. Products come from everywhere in the world, right? So you may have active ingredients for vaccines, for example, coming from China that will come for the production in Europe. The vials will come from somewhere else. So it's such a globalized chain of products that it's very concerning when any country or bloc starts to put restrictions in the movement of what are actually public health goods, right? We all need these vaccines to be equitably distributed. And for that, we need that the flow of the ingredients and the flow of the material that will be used at the end of the line, you know, and that will allow, they go even to syringes because it goes from the production, the R&D production, and then the production of the actual vaccine to the vaccine being injected in a real person, right? And all this has a line of products that comes from everywhere in the world. So it's actually, these are measures that don't benefit global health, don't benefit any country specifically, and actually can hamper the plight and the global efforts to ensure there's equitable access to these products.
Yeah, maybe further, just to add another point. You know, I think we, at a time like this, always need to take a step back, right, and make sure that we approach this in a way that is going to ensure everyone gets as much access as possible to these products. And of course, right now there's tremendous frustrations, there's disappointments, there's been a lot of excitement about the vaccines, a lot of promise, and companies have been pushed very, very hard to maximize the amount of products that they can make, and ultimately some of those promises and ambition are falling a bit short. Now, that doesn't mean that things will stop. Of course, the vaccines will continue, but they're not going to be at quite the levels that they needed to. But, you know, if you look at the counterfactual, right, companies are trying to make as much vaccine as possible, and they are trying to honor the obligations that they have in terms of those products. And then they're further stressed by the fact that we're making demands to go further than those obligations and make sure these get shared everywhere. And what concerns us the most in a situation like this is that ultimately it's the most vulnerable countries and often low-income, low-middle-income countries that suffer the most in any situation where we end up with trade restrictions or barriers. And those countries are already incredibly disadvantaged right now, as you're seeing in the rollout of these products, and we're trying to rectify that. And we certainly wouldn't want to see anything further complicated, because ultimately the higher income countries, they find ways around, they find solutions to these sorts of problems, but the damage that can be done to others along the way is what concerns us the most.
Thank you. Let's take a last question from Michael Busirkif from CNN Opinion. Michael, can you hear me?
I can hear you, Fadila. Can you hear me?
Very well. Go ahead, please.
Thank you for taking my question. Sorry, it's a bit of a double barrel. As you know, elected leaders, public officials are key to disseminating public health messaging in a pandemic. But over the last few weeks, counted elected and appointed officials have been cut out going on vacations or non-essential travel, either domestically or beyond our borders, in violation of the same advice or regulations which they themselves have either drawn up or espoused. I think this is very important to hear from WHO, especially because so many people have been adhering to the guidelines. But what would your words of advice or peer advice be to these individuals, public officials who have violated the public trust and gone against their own guidance? And just quickly, and forgive me, but because the DG spoke of vaccine nationalism, Canada has secured access to more vaccine doses per capita than any other country in the world. They've struck deals with for about 414 million doses or about 9 doses per person. And you've already talked about the shortages and the challenges facing COVAX, but is there an issue here with fairness in your opinion? And should Canada release some options rather than betting on every vaccine production horse, so to speak? Thank you.
Thank you, Michael. Dr. Van Kerkhove will take the first part of your question.
Thanks, Videla. Thanks for the question. I mean, I won't comment on individuals. I mean, I think the bottom line is that all of us have a role to play. And all of us need to be following the recommendations with the common goal of ending this pandemic. You know, this pandemic has had a tremendous impact on all of our lives. We are living through probably one of the most challenging situations that most of us will have ever dealt with. Although if we look to our loved ones of older age, they've also been through very difficult times. And we need to stay the course. There are actions that all of us take every day that will have positive consequences or negative consequences. And this is tough. We know that a year plus into this, we're tired, we're exhausted, we want this to be over, but we also have a role to play. We are working with populations and people all over the world to listen, to engage, to understand what are the barriers to compliance. And some of these are really legitimate concerns. People have to make a living. They have to leave their house to make a living, to feed their families. Others, there are inconveniences. And we need to do what we can to minimize our exposure to this virus, especially in areas where it's circulating. We've seen a number of countries that have brought transmission under control, which are having sporting events outside and are living their lives because they have brought the virus under control. We will get there, but we have to make the right decisions every single day to minimize our exposure, and all of us have a role to play. So going back to barriers for compliance, we listen and engage with many different groups, with different ages, with people all over the world to really understand what are those barriers. I think we have a lot more to do in this area of work and understanding behavior and understanding the social determinants of all of this, and working through that. So when we say to stay home, people can stay home. Governments can support them in doing so. But we need everyone's help. So do what you can. And this, we have health workers who are online, who have contributed to this press conference today, who may want to comment on this because they are out and about every single day, putting their lives at risk. And we, as non-health workers, need to do what we can to minimize our exposure, to not need health care, to not overburden an already overburdened healthcare system and keep them safe. So thanks for the question, but bottom line is we need to put in the work and we all have a role to play.
Thank you. I think that was the last question. Dr. Edward, do you want to?
Sorry, I think I'm getting the second barrel of your question, Michael, which was about countries that have contracted doses and the ability or of those countries to share those doses. So when we look at the early part of this crisis, before we knew which vaccines might work, there were many deals set by many, many countries across many different products. And while we were trying to consolidate some of those deals, in the end of the day, the many deals, what they did was they really did spur a lot of innovation by a tremendous number of companies. It resulted also not just in innovation, but also a lot of expansion of manufacturing capacity and building out capacity for those products. And of course, at that time, these were bets that many of the high-income countries were making, not just Canada. It was a wide range of countries. But ultimately, they drove what we're now reaping some of the benefits of in terms of many products proving to be successful vaccines. We heard just yesterday and again today some encouraging news about new products on even a new platform as well. So all of that very, very encouraging. And by November of December, if we just walk through the history a little bit, November of December of last year, it became obvious that a number of these products were going to be successful. So the COVAX facility, working with the EC, with Canada actually, with other countries, tried to establish what we could now call the principles for dose sharing with the COVAX facility. And what we've done is created a mechanism through which countries that do find that they have excess doses contracted, meaning that they have enough products that they know are efficacious, that go beyond their needs, or even before they go beyond their needs, they're able to share those doses through COVAX, because that's the mechanism to make sure the most equitable distribution of those possible. So we're at a point today now where many countries are looking at that, and despite the challenges now around supply, around uncertainties, around the variants as well, they're looking at the map of vaccine distribution around the world, and they are trying to now plan when they can begin to share doses. Because like the Director General said, his concern a couple of, I believe it was last week, he laid out was that as countries now vaccinate their healthcare workers and vaccinate their older populations, we need to make sure that healthcare workers, like we saw today, Sarah and Harriet, that they're getting vaccinated before we move into the non-risk populations in other countries. So really the challenge is the one that the Director General laid out in his speech, right? Can we unite and collaborate across all of the contract holders on these products, all of the companies, to ensure that every country within 100 days at the beginning of this year are able to be vaccinating at least their healthcare workers and their older populations. So that's the goal, and we're trying to create the mechanisms to make sure that's possible. We believe that is the situation today. It is possible to do that, but it is going to take still another step up in collaboration internationally to achieve it.
One last comment in the sense that, because we are seeing two movements, we know about these big bilateral deals last year, right? We've been discussing this a lot. But we are seeing a movement also of private sector trying to buy directly from the industry. Right? And we see also an increasing number of small bilateral deals from different countries in the past month. And we've been alerting that this is a movement that it's counterproductive, and it's also not necessary, because the COVAX facility is about to start the distribution of the vaccines as soon as they become approved by WHO through the emergency use listing. So I think this is important to highlight, because we are seeing that companies are being, some of them have already, we know that some of the private sector has already said no to buyers that are not public, for public use, for private use. So these two movements needs to stop, actually, because we have a global facility that's becoming operational quite soon. Countries will be receiving doses of the vaccines that are have been assessed by WHO or an stringent regulatory authority. So things will be normalizing in the next few months. So that's an important, besides the donations that Bruce has already mentioned, but I think it's important to think that this is going to, countries are going to receive vaccines. Don't panic.
Just very briefly, the DG spoke about a year ago the announcement of a global public health emergency. And he outlined at that time what we were going to need: a comprehensive strategy applied relentlessly, because at that time we didn't have the perfect tools. We had tools, and those tools were built around case detection, contact tracing, public health and social measures like physical distancing, hand hygiene, and other things. We've learned so much about the virus in terms of better and more available diagnostics, better ways of treating and saving lives, and we've seen fatality rates drop when health workers have the time and the space and the training and the PPE and the availability of medical oxygen and other things. And we can see death rates plummet in that situation. So we've not been helpless in this, and we are not helpless in this. So I would hate to think that our fears around vaccines create a helplessness again, that feeling that we can't be the masters of our own destiny. And I think the DG has been absolutely persistent in calling us all to use every single tool in the toolbox, to do it all. And I just don't want us to get, the vaccines are an important issue. The controversies around vaccine are important that they're resolved. It's important that we make progress. But as Bruce said, there's been remarkable scientific progress to get where we are. There's some serious teething problems, there are huge equity issues, but they have to be resolved. But that doesn't mean we're helpless. So we need to get back to business here, together, ourselves, scientists, governments, communities. And we need to apply the knowledge that we've learned systematically and comprehensively and answer the call that the DG has made again and again. We have to redouble our efforts and just not get distracted by the controversies and just solve the problems one step in front of another. And I think today we do that in honour and in service of those frontline workers who joined us today, to put them in a position to do the best job they can to control transmission in communities and to save lives. And I believe we can do that, and we are doing that. We just need to bring vaccines online in a more stable and predictable way, and that's just what the team here are trying to do and what the partners in the ACT Accelerator and COVAX are trying to do.
Thank you. Dr. Tedros, final words.
Thank you, Fadila, and thank you to all our colleagues who have responded in a very powerful and effective way. And thank you also for those who have joined today, especially to Harriet and Sana, our respect and appreciation. And we're here to support you, and we hear you very clearly, and we will continue to support you. Then on the vaccines and other products, I think we have to look back back into history. If you take HIV/AIDS, there were medicines available, of course, several years after the pandemic was raging. But then when medicines were available in high-income countries, in rich countries, they were not available in developing countries. And the medicines actually arrived in developing countries almost a decade later. I don't think that's a good history, it's bad history. Then second, it was during the epidemics of H1N1. There was vaccine. The vaccine was purchased by wealthy countries, and vaccines arrived actually in the developing world when the pandemic was over, or the epidemic was over. So it's a choice. Do we want to repeat the same history now? I don't think so. If we hoard vaccines and if we're not sharing, there will be three major problems. One, I said it will be a catastrophic moral failure. And two, it keeps the pandemic burning. And three, very slow global economic recovery. So it's morally wrong in terms of arresting the pandemic. It wouldn't help, and it wouldn't also bring livelihoods back. Is that what we want? So it's our choice. And I hope we will choose the right things. For now, what WHO is saying is, if countries can vaccinate their health workers and elderly and people with underlying health conditions, it's enough. So let's have the world, at least all countries, have this first, and then we can move to the next. And this is a small world now, a village, a global village. And we need to help one another. It's only through solidarity and unity that we can defeat this pandemic. It's not through me first attitude. I thank you. And see you in our next step. Presser, thank you.
Thank you, Dr. Tedros, and to our participants, including our guest. I would like just to remind you that we will be sending you the audio file plus Dr. Tedros' remarks just after this press conference. The full transcript will be available on the WHO website. Have a nice evening and weekend. Thank you.